Hey everybody, Mr. Taylor back again for our last lecture on muscle anatomy. This is part four, where we're going to be learning about the lower body, including the abdomen and the legs. So let's go ahead and get started. All right, so the first thing we're going to take a look at are the abdominal muscles. And there are four abdominal muscles listed here: the rectus abdominis, transverse abdominis, external obliques, and the internal obliques. And if you notice, you may see that I have a couple of pictures here. Namely, I have one that's our anatomical picture, and you can see all these muscles in the abdominal area. Down here, in case you're wondering what this is, it looks like a big, thick piece of bacon. That's actually a pork belly. And what's really interesting about a pork belly is it is the belly of a pig, and you can actually see its skin, and you can see some adipose underneath, and then you see all these little bands of muscle. Guess what those are? That's right, you've been eating pig abs if you've been eating bacon. Just thought I'd let you know. And of course, there's a little comic there for you to enjoy. Okay, so onto the muscles. The first muscle we're going to talk about is the rectus abdominis, and it gets its name rectus because it is it's a vertical muscle. It goes straight up and down vertically across the belly, and so we can see this in our diagram right here. This is our muscle that forms the quote unquote six pack or washboard abs, as some people like to call them. So the rectus abdominis goes, as you can see, straight up and down. In the middle, there's a left and a right one, and in the middle, there's this thing called the linea alba, which is Latin for the white line. So there's like this little band of tissue, and you can see there's some little bands of tissue going laterally, transversely through this muscle. Anyway, the rectus abdominis, it arises from the pubis and the pubic symphysis. So its origin is down in the pubic area, and then its insertion is in the bottom of ribs 5 through 7 and the xiphoid process. So in other words, what this muscle is going to do is it's going to move its insertion, or the rib cage, down towards the pubis, and it's basically going to flex your vertebral column, which is what we call it when we do a sit-up, or what you guys might call crunches. It also compresses the abdomen, which is the anatomical term for saying that it sucks in your gut. So when you contract this muscle, it kind of pulls together tightly and kind of pushes your internal organs inside. The next muscle is called the transverse abdominis, and it gets its name transverse because it runs transversely. So it runs horizontally across the abdominal region, and it's found in the abdominal region, so that's where we get abdominis from. So the transverse abdominis is actually the deepest of our abdominal muscles. And in the illustration, you can see it right here in this little tiny window. There's like a little tiny space that's in here. And so it's the innermost of your abs. The transverse abdominis, it arises from the back, in the ilium, the lumbodorsal fascia, and your ribs. And then it inserts onto the xiphoid process, so down at the bottom of your sternum, and along the linea alba, so along the front and center, along the body's midline, and on the pubis. So basically what this is going to do is this muscle is going to pull from your xiphoid process down to your pubis, all along this linea alba. It's going to pull that back towards its origin, that's kind of like on the lateral and posterior side of the abdomen. And it's going to compress your abdomen. And so this basically, it's a one-trick pony muscle that's going to suck in your gut, essentially. Okay, so the next muscle, the external oblique and the internal oblique. We'll go ahead and talk about these together. These two muscles are given the name oblique because they run at an oblique angle. So far we've had a rectus abdominis that went vertically, and we had a transverse abdominis that went horizontally. The obliques run at an oblique angle, so they kind of run diagonally across the sides. If you look at these two muscles, the external oblique, of course, is the most external of these two muscles, and it arises from the bottom ribs, so ribs 5 through 12, and then inserts onto your linea alba, once again, right in the middle of the abdomen, and along the iliac crest, which is like the top of your hip bone. If you look at the internal oblique, it has the opposite. It arises from its origins on the iliac crest and the lumbodorsal fascia in the lower back, and it inserts onto the linea alba. So it kind of starts down below and moves up towards the linea alba, where the external obliques start up at the ribs and insert down on the linea alba. And the reason for this is that the obliques actually run at right angles to each other. So your external oblique, if we look in this diagram, we see it starts up here at the bottom of the rib cage and it runs down at an angle, so like it moves like medially and inferiorly onto the linea alba. The internal oblique, on the other hand, starts out here and runs kind of at an angle superiorly and medially up here onto the linea alba. And so these both kind of crisscross. And what they both do when they contract is that they're both working together to rotate or like twist your torso and to also laterally flex, which is like bend sideways. So like if there was something like, down on the floor and you had to like bend your torso to the side to pick it up, that is what you would use. If you were twisting, and we use the twisting motion a lot of times, like when we're throwing a ball or hitting a ball, whether it's like baseball, softball, golf, whatever, or any type of throwing, you use a lot of your what we call the core muscles, and the obliques are doing a lot of that, like twisting and turning. So here's like a closer up, better view diagram of all the different ab muscles. And you can see the rectus abdominis kind of runs through this little pocket in the front. We can see that we have the external oblique that kind of meets up, and it actually runs a little bit under the rectus abdominis through this little aponeurosis over here into the linea alba. The internal oblique we can see is coming from the back and the hip and running up to the linea alba. And then underneath all of that, we have that transverse abdominis. And each of these muscles are incredibly thin. If you've ever done a dissection of an abdomen, you know that it's very easy to cut all the way through and into the ventral body cavity. Okay, so that brings us to the leg muscles. And if you're looking at your screen and you're saying, wait a second, that looks like a ham, guess what? You're right, that is a ham. We are going to learn all about the anatomy of ham in this section. And so I have a nice picture of a ham sitting there. To the left and to the right of that, you can see there's a diagram with a whole bunch of labeled muscles. Those are the muscles of a pig's leg. And we are going to go through and learn where those muscles are in our leg and learn about human ham. Yeah, it's pretty gross. Anyway, so there are 14 muscles we're going to learn about in the leg. So let's go ahead and get started. All right, so the first muscle we're going to talk about, and when we say leg, I'm using that very loosely. Anatomically, your leg is just like from your knee to your ankle, but we're talking about the lower limb. The first muscle we're going to talk about is the gluteus maximus. So gluteus literally meaning buttock and maximus meaning large. This is like your large buttock muscle. The gluteus maximus is very large and superficial. It's very easy to find. It bulges out of your posterior and is, a very prominent muscle. And so the gluteus maximus, it arises from the medial ilium. So if we go back here, it's coming off of the hip bone. So it's coming off of this iliac region, and it's posterior sacrum and coccyx. So it's going down onto the tailbone, and it's inserting onto the posterior part of the femur. So it's running along the back of the femur here. And so it kind of makes a very large band of a muscle. In fact, interesting little thing about the gluteus maximus is it's huge in humans. That's where it gets its name from, gluteus maximus. It's one of your largest muscles. In quadrupeds, in four-legged animals, it's very small. And the reason why is because the gluteus maximus is used to extend your hip joint, and basically it allows you to stand on two legs. So the next time that someone has a nice gluteus maximus and you notice it, you're really saying to yourself, wow, that person's really good at standing on two legs. So that's what you're checking out about that person. But it extends the hip joint, and because we in our normal standing position do a lot of hip joint extension, a lot more than most animals do. Just look at your pets if you have any. That's why we have a huge gluteus maximus. It also does a little bit of lateral rotation, which means it kind of rotates your knee outward, if you remember. But its main function is the extension. And, of course, if you wanted to strengthen your gluteus maximus, besides just standing, you could do walking, running, or climbing stairs is really good because it's going to extend and lift up all your body weight when you extend your legs. Okay, so right next to the gluteus maximus is this muscle called the gluteus medius. And you can imagine it's not quite as big as the gluteus maximus. The gluteus medius is located right up here, a little bit farther up on the hip joint than the gluteus maximus. And it's a smaller muscle. It's kind of medium size, and that's where it gets its name. It arises from the iliac crest and inserts onto the greater trochanter, which was that big bulge in our hip bone. And it is used to abduct the hip. So it's used to pull the leg out and away from the body, so it moves away from the midline. It also does some bit of rotation, both medially and laterally, so it's a bit of a rotator. The third muscle that we find in this region is this little guy called the tensor fascia latae, which sounds like something that you would go to Starbucks and order, but it's actually a little muscle right here, kind of on the side of the hip, down below the gluteus medius. And the tensor fascia latae, based off its name, tensor tells you that it tenses. And it tenses this little band of tissue called the fascia latae, which is a band of connective tissue that runs across the front of the thigh. And when this contracts, it's going to abduct or pull the leg away from the body. So the tensor fascia latae, it arises from the iliac crest. So even though we see it kind of all the way down here, it actually has a band of tendons that go up over the gluteus medius and connect it onto the iliac crest. So it's kind of a bit of a longer muscle when you include the tendons. And then those tendons extend all the way down through this thing called the fascia lata and connect onto the iliotibial tract, which eventually goes into the lateral part of your tibia. So it goes all the way down into your lower leg. And when this contracts, it basically pulls the outside of the knee at the tibia laterally and allows it to abduct or abduct away from the body. And it does a little bit of flexion too. So let's take a look. This is another view we have. So in this view, we can see here's the gluteus maximus. It's been cut away because it's such a big muscle, it covers up all the other ones. Here's the gluteus medius. It's also been cut, but you can see how it kind of is underneath the gluteus maximus a little bit. And they both go down and insert onto the back part of our femur. We can also see in this view, we can see here's our tensor fascia latae. We have a much better view of that. And we can see how it's got some bands that connect it up onto the iliac crest. And then it runs down around the outside of the leg through this little tiny fascia lata region. And it hooks onto the outside of your knee. All right. On to muscle number 4. This is by far my favorite muscle of all time, the sartorius, also known as the Taylor's muscle. And you can guess why I like that so much. The sartorius gets its name because of what it does. So let's look into that. It arises from the anterior iliac spine. So this is another muscle that's coming off of the hip bone. So it's another muscle. And right here, you can see it comes off just about the same spot as the tensor fascia latae. But instead of running laterally around the outside of the leg, the sartorius goes across the thigh. So it kind of goes at an oblique angle and it inserts onto the medial side of the tibia, as where the tensor fascia latae was on the lateral tibia. And so the sartorius's job is to flex our hip and knee. And so what it basically does is it's going to bend your leg as if you were going to cross your leg. So if you were sitting down and you were to lift your leg up and cross it so that your ankle is sitting on top of your knee, that is what the sartorius muscle does. You use this also anytime you like bend your leg and lift it up. So like, let's say you were sitting on the floor. I believe the kids now call it crisscross applesauce, I think is what kids call it, or whatever you want to call that, cross-legged, however you describe it. That is what the sartorius does. And apparently tailors had to like cross their legs or crouch down using this hip and knee flexion. And so that's where it gets its name from, the sartorius. The fifth muscle on here, oh, by the way, I almost forgot. The sartorius is a really long muscle because it goes all the way from the lateral part of the hip all the way down to the medial side of the knee. It's actually your longest muscle. And so I had a student teacher a couple of years ago who used to call it sartorius BIG, which I thought was pretty hilarious. So little shout out to Biggie. Great. Muscle number 5 is the gracilis, and gracilis means slender. So this is a very thin, slender muscle. The gracilis is located in the groin, which I also think is great, the groin gracilis. But it starts right here. It arises from the ischium and pubis on the medial side of the leg. It goes just underneath the skin, so it's just deep to the skin, and it runs all the way down the inside of the thigh and inserts onto the tibia. And because this muscle is located on the inside of the thigh, when it contracts, it acts as an adductor, adductor, at the hip, and it's going to pull the legs together. It does a little bit of flexion, like kind of as a secondary thing. It does a little bit of hip and knee flexion, but its main job is to adduct. And so if you've ever like pulled your groin, you could have possibly pulled the gracilis. All right, the next muscle we're going to look at, we're moving on to the hamstrings. And the first hamstring we're going to look at is called the biceps femoris. And so biceps, a lot of people think of, the biceps in their arm. That's your biceps brachii. The biceps femoris is literally two origins in your femoral region or in your thigh. And if you look at the biceps femoris, it arises from the ischium and femur, and inserts onto the head of the fibula. So what's interesting about this, here is your ischium over here, and then all the way out here is the fibula on the lateral side. So the biceps femoris, its job is it kind of like crisscrosses kind of obliquely across the back of the leg. And it does something very similar functionally to the biceps brachii in the arm. It is a flexor, except instead of flexing the elbow joint like the biceps brachii, it flexes the knee joint. And this is the most lateral and superficial of your three hamstrings. And so apparently, if you were to take a pig and butcher it to make a ham, there would be these little like tendinous strings sticking out of one end of the ham, and that was one of them, and that's where they get the name hamstring from. Now, if you look at your own knee, if you've ever felt the back of your knee, you may have noticed on the lateral side, there's this like really kind of like thick tendinous band. And if you notice on the inside of your knee, there's also another thick tendinous band that kind of stick out through that popliteal region. And those are the hamstrings. And if you've ever pulled one, you know it's not a good time. But basically, all the hamstrings do is that they flex the leg at the knee. So that's what our biceps femoris does. There's two other hamstrings that we're going to talk about called the semimembranosus and the semitendinosus. So where the biceps femoris kind of started medially and went laterally, these two muscles start in the same place, but they stay on the medial side. So these are your medial hamstrings. The semimembranosus arises from the ischium, and so does the semitendinosus. So they both start in the same spot, and they both insert onto the tibia. They also have the same function. They all flex the knee. The main difference is the semimembranosus is the most medial of these three muscles. So it's a little bit more on the inside, pulling on that medial side, and it's a little bit wider and thicker than the semitendinosus. So I always remember the difference between these two. The semimembranosus, I think of a membrane as kind of being like a wide and flat thing, like membranes that we talked about were always flat sheets. The semimembranosus is a wider, flatter muscle, and the semitendinosus is kind of like long and skinny, like a tendon. So I think that helps me to remember which one's which. And you can actually see that here. So here's our biceps femoris running straight across, and it's actually pretty large. And then on the medial side, here's our semimembranosus. And then this little tiny thing is the semitendinosus. It actually overlaps the semimembranosus, so it makes it look a little bit smaller. But really, the semimembranosus actually completely spreads inside of this. And you can see that down at the bottom here. There's a little more space for the semimembranosus. Good. Okay, so here's a diagram of a cross-section of the leg. So this is our ham picture once again, but this is a human body diagram. And you can actually see, if you look back here, you can see some of the muscles we talked about. So we already talked about like the sartorius, for example, up in here. But if you look down here, here's our gracilis, almost forgot about that. But if you go around to the posterior, you can see here's the semimembranosus, and it's kind of, I think, wide and flat. The semitendinosus is more like round and long, kind of like a tendon. And you can see over here, this is our biceps femoris, and it's the big biceps. It's a pretty large hamstring muscle. And you can see they all go together into the same group. Okay, so that brings us to back to the front of the thigh with the quadriceps femoris. And so, of course, we talked about like biceps having two origins and triceps having three. So the quadriceps has four origins. And so sometimes people consider the quadriceps to be one muscle, some people consider it to be four. We're going to go ahead and name all four parts, but there is a little bit of conflict over this. But the four parts that make up the quadriceps muscle, and you can either think of these as individual origins and parts of one muscle or as individual muscles themselves. But we have what are called the vastuses, the vastus lateralis, vastus intermedius, and vastus medialis, and the rectus femoris. And I've kind of described where you find them. The vastus lateralis, of course, is the most lateral. The intermedius is in the middle. That's what intermediate means. The vastus medialis is the most medial, and the rectus femoris is the most superficial of these muscles. So I'm going to back up for a second and show you what these look like. So the hamstrings we just talked about were in the posterior part of the thigh. These guys are up here in the anterior part of the thigh, the quads. And so you can see the rectus femoris is the most superficial. It sits up on top, and you can actually, when people have a pretty well-defined one, you can see this kind of like bulging out by itself out of the front of the thigh. Think of like maybe like a soccer player or like a weightlifter. Uh, then if you look at the vastus lateralis over here, you can see it's on the lateral side. So this is the outside of the thigh, and it kind of wraps around. We have this vastus intermedius, which is the intermediate muscle in the middle. And then we have this vastus medialis, which is the most medial on the inside. I think this is kind of like a hot dog and its bun is how I kind of describe how the quads work. So, our rectus femoris would be like the hot dog, and the vastuses all kind of form like this bun that wraps around it. I know that's a pretty sloppy looking hot dog bun, I know, but it's just an analogy. All right, so if you look at the quads, they all have the same origin. They all arise from the ilium and the tuberosity of the femur. They all insert into the tibial tuberosity. In fact, they actually use the same common tendon, which is why a lot of times we consider this to be one muscle, even though in that illustration you could see how they had separate parts. And they all have the same action for the most part. So all of your quad's job is to extend the knee. They like straighten the leg at the knee. So think about when you're standing up. So you have your knees bent and you go to stand up. Your gluteus maximus is going to extend your hip, but your quads are going to extend your leg at the knee. So use both of those muscles when you're doing like steps and standing up and things like that. The rectus femoris has like a bonus extra feature because it's kind of more separated from the vastuses, in that the rectus femoris also does a little bit of hip flexion. So while you're extending your knee, it kind of pulls the leg forward. So if you think about like if you were kicking a ball, you would have to, when the ball comes, and you want to kick it, you would be both extending your leg at the knee and you would be flexing your thigh at the hip. And so that's why, I said soccer players tend to have like really well developed quads, because that's the muscle that really gives you the most power in your kick. And it says here it's the strongest and leanest muscle in the human body. There's a lot of debate over what's the strongest muscle in the body because it really depends on the person. But for most people, your quads are definitely quite strong, and they're usually very lean. There's not a whole lot of like fat or extra tissue in there. Okay, moving right along. We got two muscles that work really close together, the adductors of the groin. We have the adductor femoris and the adductor longus. Now, I put adductor femoris in here because originally this is for us to use with our cat or mink dissections, but this year we're not doing that. So in the human body, this muscle is called the adductor magnus, and it's called adductor magnus because it's big. It's your largest adductor. And of course, adductor or adductor means to, pull together, pull towards the midline. And so both of these muscles, both the adductor magnus and longus, both are adductors of the femur at the hip. They both pull your legs together. If you look at their origins, they both arise from the pubis, although the adductor magnus has some attachments onto the ischium. And if you look at the adductor magnus, it inserts onto the medial condyle of the femur. So it's going to hook on to like the inside of your femur and pull it in towards like the middle of your pelvis. If you look at the adductor longus, it hooks onto the posterior femur. So it's a slightly different insertion, but it also still works to adduct. And you can take a look at these muscles right here. So if you go back for a second, remember we talked about the gracilis, how it was like real slender just under the skin. That's the gracilis. And just deep to the gracilis, we can see here's this adductor longus, which is, of course, a very long muscle. And then down here, we see the adductor magnus. And you're like, well, wait a second, Captain. You said that was a really big muscle, and it is. It's just that you can't see it because it's deep to these other two muscles. So just take my word for it. It's huge. Okay. We're almost done. We're in the home stretch. We're all done with the thigh, and now we're on to the lower leg. And so the first lower leg muscle we're going to talk about is called the tibialis anterior, and it gets its name, tibialis, from the fact that it's very closely connected to your tibia, and anterior because it's found on the front of your tibia. And so this muscle, if you've ever gotten shin splints before, you have experienced pain in your tibialis anterior. And so what the tibialis anterior is all about is it starts up at the it starts at the proximal portion of the tibia, and it goes all the way down across the anterior of your shin and inserts onto the foot at the first cuneiform and first metatarsals. So you can actually see that in the illustration here. So here is tibialis anterior, and it's going to insert up here on the front of the tibia, and it comes down, goes across your ankle, and it's going to insert onto your foot. The tibialis anterior's job is to dorsiflect the foot. What it means is it's going to pull your foot, unlike your toes, up towards your shin. And the reason why this is really important is because this muscle prevents you from tripping over your own toes. So if you've ever gone for a walk or for a run, you have to lift your toes up so that they don't, get snagged on carpet or whatever, or rocks or whatever. And that's what the tibialis anterior does. But if you are running a lot, all the stress and strain from your feet slamming down into pavement or whatever surface you're running on can cause this to kind of like start to stretch and strain. And actually the tibialis can start to like pull on the bone. And if you just start to like tear the muscle or tear the tendon, you'll feel some shin splints going on. You can also get stress fractures in your leg as well. That'll feel very similar to tears in the tibialis anterior. And this is when you have to go see a trainer to get checked out. But very important muscle. The last two muscles we're going to talk about are the posterior part of the leg in the calf region, and they're called the gastrocnemius and soleus. The word gastrocnemius, gastro means like belly or stomach, and apparently the word gastrocnemius comes from the phrase the belly of the leg. So if you think about it, like you ever look at someone's calf muscles, they kind of stick out like a little fat belly sticking out of the back of their leg. That's where this gets its name from. So the gastrocnemius is the most superficial muscle back here, and it actually has like two heads. It has two little parts, one on the medial side and one on the lateral side, and these actually arise up here on the lateral and medial condyles of the femur. So that's why we see these two parts. And then they come down, they go through the Achilles tendon, or what we call the calcaneal tendon, and insert onto the calcaneus, which is your heel bone. And so when this muscle contracts, the muscle fibers contract, they pull on your Achilles tendon and they pull your heel up towards your femur. And that movement is what we call plantar flexion. So it mostly plantar flex or points your toe. It also does a little bit of flexion of the knee. And so you can actually feel your gastrocnemius. It's a very superficial muscle in the calf. And you can actually find where it goes all the way up into that popliteal region onto the back of the femur. The last muscle we're going to talk about is called the soleus. And the soleus does the exact same thing as the gastrocnemius. It also is a plantar flexor of the foot. A little bit different though. Its origins are down in the leg, the fibula and the tibia. So it's a little bit of a shorter and deeper muscle. So that's why we don't see it that well. I'll show it to you in just a second. But you can see a little bit of it in this illustration just underneath your Achilles tendon. It runs deep to the gastrocnemius. And it also plantar flexes the foot. So let's take a look. There's the same picture I just showed you with the gastrocnemius and the soleus. But if you look at it in side view, you can see here's the gastrocnemius sticking out like the little belly of the leg. And then underneath that, we can find the soleus. So it's kind of like the deeper muscle. They both go down to form this calcaneal tendon to go down to the calcaneus here. Here's our tibialis anterior in the front of the leg, and it's going to run down into the foot to do the opposite movement, which is the dorsiflexion. So that's it. Guess what? That's all, folks. Thanks for listening. Hope you learned a lot about the muscles of the lower body, and we'll catch you next time. Hey, don't forget, if you enjoyed this little lecture, don't forget to click on that subscribe button. That's it. All right, we'll see you.